Good evening, everyone. Good evening. How you doing? Great. It's great. It's great to be here. I want to first say thank you for the opportunity to address this rally and this march. Thank you on behalf of the Greater Hartford Interfaith Coalition for Equity and Justice, where I serve as president, and thank you on behalf of the Unitarian Universalist Society East in Manchester, where I serve as pastor. This year, in the work for healthcare, we are finding ourselves, and you may be finding yourselves, quite frustrated, quite angry, quite disappointed with our leaders in the state and at the federal level, who clearly are backtracking on any of the progress that we've made on healthcare in recent years, and clearly in Connecticut are saying in no uncertain terms, we don't care about the 400,000 residents of this state who still don't have access to quality, affordable health care. Now, a little background. We've known for a while in Connecticut that a single-payer universal system was not going to be politically feasible. So those of us who wanted a single-payer system because it meets that moral criteria of giving care to all people, those of us who wanted that said we would compromise. That's good behavior in a democratic system, right? We said we would compromise. We said we would work for a blended system that would combine the best of public programs and private programs to get to near universal health care. That was the idea behind Sustanet. You've all heard of Sustanet. Sustanet was, if we had let it go, if we had let it be the program that it was designed to be, it would have been one of the most powerful state public options in the country. It would have been a model for public options in healthcare around the country. And we got a certain amount of the way, but this year when we had the chance, our leaders have been backtracking. We keep hearing that word no. Every little bit we want, we keep hearing that word no. No, 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 no. And here's the thing. I don't mind if the opposition says no. I understand in a democratic society you're going to hear no from time to time. But what I do mind is when the opposition says no and doesn't offer an alternative, so that we can maybe find some common ground, so that we can maybe work together and get the 400,000 people who still need health care in this state, get them that quality, affordable health care. I do mind when the opposition says, no, we don't care. And now I know the opposition would say, Reverend Pawelek, we do care. How dare you say that we don't care? How dare you say that? They would resent that allegation. Yeah. But here's the thing, if you say no and you don't offer an alternative, I'm going to judge you based on your actions, not on what you say. And if you say no, and if you say it again and again and again, guess what that means? It means you don't care. Exactly. It means that. Yeah. And we can make no other conclusion. You don't care when people, those 400,000, don't seek health care when their health problems could be preventable, and instead they wait until they're sick beyond measure, until their health is irreparable, and they go to the emergency room. And then who pays for it? We pay for it. See, that's the thing. We're already paying for it. We're paying for it in higher taxes. We're paying for it in increased medical costs. We're paying for it in higher premiums for those of us who do have health insurance. We're already paying for it. That's a problem. And when the opposition says no, 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 that's what we're saying. We're okay with that status quo. That's not right. That's not democracy. That's not shared sacrifice. So my message to the opponents of healthcare reform is this: offer a realistic alternative, or get out of the way, because people are dying. Show that you care, or get out of the way, because lives and families are being destroyed. Agree to share in the sacrifice. Agree to balance corporate needs with needs of the people. Agree that the health and well-being of all our neighbors matters, or get out of the way, because it's shameful that in one of the wealthiest states in the country, in one of the wealthiest countries in the world, if not the wealthiest country in the world, it's a shame that we can show so little care for our neighbors, for the 400,000 who don't have health care.